Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to talk about another hormonal test, that is prolactin, or we also call that lactotropin test. Okay, so what is prolactin, or we can say lactotropin test? So we will talk in this video lecture. So my name is Muhammad Kamil Khan and you guys watching Kami Microbiologist channel. So let's start the video. In this video, the main content that we are going to explain, that is introduction to prolactin, that what is prolactin. We are going to see function of prolactin, what is prolactin test. We are going to see that what is prolactin test, why the prolactin test is performed, means diagnostic importance of prolactin test or purpose of prolactin test. We are going to see the requirement of the test. We are going to see procedure, normal range, condition in which the prolactin level is get high and low in the body. First of all, let's start the topic with introduction. Prolactin remember, prolactin test is also called lactotropin test. It is that test in which the prolactin level in the blood is checked. Okay, now what is actually prolactin? Prolactin is actually the peptide hormone, okay, that is mostly produced and synthesized from the pituitary gland, anterior pituitary gland, that is synthesized and prepared by lactotrop cells that is present in the anterior pituitary gland. Now the function of prolactin is to stimulate, we can say to activate the mammary glands. So when the mammary glands get activated or stimulated, so what will happen? It will produce the milk. Moreover, it can also improve the breast development, means it can increase the size of the breast. So when the breast size is increased, so what will happen? Large amount or many, or we can say a high amount of milk will be stored. So the milk storage large, or we can say if the milk are increased, so obviously the breast size is developed, okay, or the breast size is also large. Moreover, it can also maintain the lactation process, or we can say the process of lactation, the process of the milk maintain, like whenever the milk is high needed or low needed, so then at that condition the prolactin can maintain the lactation process, we can say like that. It can also improve it can also metabolize the vitamin D, calcium and carbohydrates. Moreover, it can also help in the menstrual cycle in the female, okay, and it can also stimulate and activate the testosterone level into the male. Although it is not important for the testosterone, but somehow it can also improve the testosterone level and activate the testosterone in male. Moreover, it can also improve the hair growth in the body. So this is about the introduction to prolactin. Now let's talk the purpose or importance, that why this test is recommended. So this test is recommended to diagnose, to check the hyperprolactinoma. Hyperprolactinemia is actually the condition in which prolactin is secreted in a high amount. So this test is used to check the high level of prolactin, that or to check the main causes of high level of prolactin. It is also recommended to check or to evaluate the pituitary disorder like pituitary tumor, which we can say prolactinoma, okay. It can also be used to check infertility issue in male and in female. Moreover, it can be used to diagnose the galacturia and amenorrhea in case of female. Galacturia is that condition in which high amount of milk is produced in the high amount of milk is produced in the or stored in the breast during and after pregnancy. Galacturia is also the condition in which, let's suppose, if a woman or girl is not get married, and if let's suppose she is not pregnant, and still the milk is produced from their breast. This condition is called galacturia. Amenorrhea is that condition in which the menstrual cycle is stopped in the female, okay, or when the menstrual cycle is not when the menstrual cycle is not happen into the female, we call it amenorrhea. So due to prolactin test we can check the galacturia and amenorrhea issue. Due to the prolactin test we can also diagnose the hypogonadism and sexual hormones. Hypogonadism means a low level of sexual hormone from the gonads. Gonads is actually the sexual organ, like in female ovaries and in male testes. And we better know ovaries produce ova and testes produce testosterone. And it can also used to check the sexual hormones. So for example, the sexual hormones is secreted, so then the male and or the male and the female can perform the intercostal, or they can doing sex. So it is also due to the sexual hormone production. So this test is used to just check the sexual hormones, or it can also used to see the sexual desire in male and female. Okay, so this is about the purpose of prolactin test. Now this let's see that what we require to perform that test. So for the for this test we require different material. As you can see, we need a pipette, yellow tips, this is the serum which we obtain after the centrifugation, and we can take the blood into the, this is the gel tube, but we can also take the blood into the red top and blue and green top as well. Now this is the personal protective equipment, in which we have goggles, gloves and overall, or we can say lab coat. This test is not only performed onto the fine care machine, but we can also perform this test on Mendray machine as well, okay, or advanced machine as well. So but mostly if let's Mendray machine is too much expensive, so if let's suppose we not afford this machine, so then this test is mostly recommended onto the fine care machine. Now this is the fine care machine, this is the fine care kit, which contain the strip, or we can say cartridge, and this is the ID chip. Okay, so we need these things while performing that test. So let me show: personal protective equipments, fine care kit and machine, patient blood serum in gel or red top or green top tube, pipette or jester, and yellow tips. Now let's see the procedure, that how to perform that test. First of all, we have to take the patient blood sample in gel tube or in red top or green top tube. Okay, once the patient blood sample is collected, so then it should be centrifuged to get the serum. After that, we will take 75 microliter serum and will mix it into the buffer. Okay, so mix the 75 microliter serum into the buffer and will mix it 10 times. Then we will put 75 microliter the mixture into the strip, into the wells of the strip, and will incubate it at a room temperature for 15 minutes. After 15-minute incubation, then we will read the strip into the fine care machine, quick or standard. Now we will doing the quick test when the incubation time is done outside the machine, and when we are doing the incubation time inside the machine, so then we will click on the standard. So and now by clicking on the standard, then it will take 15 minutes. After the 15 minutes, then it will give us the test result. So this is how the whole test is performed. Now let's see that what is the normal range or reference range of prolactin. So in men or in male, the prolactin level is less than 20 nanogram per ml. Okay, in female, mostly in pregnant women, the prolactin level should be 20 to 400 nanogram per ml. In non-pregnant women, it should be less than 25 nanogram per ml. So this is about the normal range. Now let's see that what are the main causes due to which the prolactin level get high into the body. So there are different main causes. First of all, we have pregnancy and breastfeeding. So when the woman get pregnant, so what will happen, the dopamine is actually the a kind of hormone that will be stopped, and due to this way prolactin hormone will be increased. Another is breastfeeding. So what will happen when the baby sucking, and when they are sucking the nipples, so what will happen, it will activate the pituitary gland, and it will secrete the prolactin hormone. We have stress and exercise. So when there is a exercise of the breast, and when the breast is pressed, or when the breast exercise is doing so, when there is a stress or any other exercise or stress, so due to this way the prolactin level is also increased into the body. Pituitary and hypothalamus tumor, hypothyroidism, chronic liver and chronic kidney disease, polycystic ovary syndrome. It is that condition in which the ovaries is not working, or it will not produce the ova, menstrual cycle is not performed, so this is called polycystic ovary syndrome. Certain medication like risperidone and haloperidol, it is that type of medicine when it is taken by the female, so what will happen, the dopamine is decreases, or it is stopped, and prolactin is secreted in a high amount. Galactorrhea I already explained. Infertility. So these are the main condition in which the prolactin get high. Now let's see that in which condition the prolactin get low into the body. So the first is infectious infection like TB, tuberculosis. Head injury, we better know in the head there is a brain, and in the brain there is a pituitary gland, and the pituitary gland, when there is a head injury, so obviously prolactin level get low. Is Shen syndrome. Shen syndrome is actually the necrosis of the pituitary gland. Next we have autoimmune disease, radiation therapy, severe thyroid disorder. So these are the main condition in which prolactin level get low. So this is all about the prolactin. I hope this video is helpful for you. Thank you so much for watching. If you like this video, so make sure to hit the like make sure to hit the like button, share this video, and definitely subscribe my channel to get more interesting videos like that. Thank you so much for watching.